Today, we are taking your health back with me, Wendy Loh. We are coming to you from our studios of ThinkTech Hawaii in downtown Honolulu and my home office in Makiki. Remember going to the dentist as a keiki? And remember the dentist filling our cavities with mercury and dental amalgam? We didn't know any better back then, but today I have Dr. Ron Carlson here with me, and he will open our eyes to why we should not be doing that. So, welcome, Dr. Ron Carlson.
Thank you. Thank you for having me.
Yes, and I know you like me to call you Ron, so we'll go with Ron. All right,
That's
Ron?
Good.
Okay. So, Ron, what is spiritual anatomy?
Well, spiritual anatomy is, I think, the foundation of every being on the planet. It's where we start, but we're not taught that in medical science or dental science. The gross anatomy is the things that it's focused on. Sometimes the mental anatomy a bit, but nothing about the spiritual anatomy. So there are actually three bodies as depicted by the presentation that we're making with the visual, that it shows the inner red, which is the spiritual cell body, the blue is the mental cell body, and the external force is the yellowish, I believe, no, blue. Excuse me, my visual is not here. Yeah, so the outer shell is actually called the physical body. And that is what we study anatomy. Dentists and physicians go through anatomy extensively, and that's the only thing we're taught. We're not taught anything about the mental anatomy, which is what you call acupuncture or acupuncture. So that's what that depiction is, and that's where we begin with the creation and the creative being. And that's a key point to the understanding of taking your health back, like you so well say, is that you're a spiritual being and you have that power and you have that ability.
You're a special doctor because you hit it right on the nose. The spirituality and the spiritual anatomy, that's so key. And like you said, many medical professionals don't speak about that, and they usually leave that part up to the church. But as you mentioned, that is so key. The spiritual health of a body, of a being, and a mental health of a being, it is so critical. And I'm glad you're going to address that.
Yes, it is. Wow. It's essential.
It is essential. Thank you. As well as, your temple, keeping the physical healthy and with the right proper nutrition, and mental and spiritual is just as equally important.
Yeah. To have a happy heart or a healthy heart, you have to have a happy teeth or gums in the oral cavity.
Right. And, I can resonate with this so much. And I am a heart patient, and they would not let me go to the dentist back in the day without being properly pre-medicated. And you might talk about that in a bit as well. I'm not sure. But yes, because the mouth is a gateway directly linked to the heart. And as a kid, I understood that so well. And even as a child, because of what I experienced with my heart condition. So let's continue and move further on. I must say, though, you are a great animation artist. Please tell us what this next cartoon character demonstrates.
Yeah, this character is on the back of my book, back here. And it shows the circulatory system of a human body. And so this individual who's the cartoon character, he has an abscessed tooth, which is actually right up in the corner right here. And it shows the interconnectivity of the body from the oral cavity right to the toes. So everything is circulatory, and that's the one main idea I wanted to convey, is that everything is a circulation of energy. Yes. So bioenergetic dentistry, biological dentistry focuses on that aspect of the subtle energy fields that you can't see with your eyes, because we're precluded for that, because we're not tuned to that field. So our eyes are tuned to the physical, and we get stuck in the physical, and we only look at that, rather than having compassion and love for our patients or each other.
Right.
And so it's very critical at this time in the awakening that this is taking place in all fields, I believe, medicine, architecture, and other disciplines, education. It's very critical to have a moral, ethical standard by which we operate.
Mhm.
And so that's the second slide, basically. And to talk about hardening of the heart, you have that experience. The medicines that we take actually to preclude pericarditis or issues from the dental are really hardening the heart, because all medicines condense physical matter. They have a condensing, they become poison toxins. So although they are good on the outside as doing well for people, they cause their own problems. So I try to stay away from heavy medicines, using homeopathics, or just simply God's light through the palm of the hand can help the circulation flow.
Wow. Amen. I wish I found you sooner because, back in the day, I'm just going to say it, it was regulated that I be pre-medicated with a lot of antibiotics before going onto the chair and after. And I know all those antibiotics, after research and after I was able to study on my own, I knew the damage that it was doing to my body. And I've tried very hard, and that's why my whole lifestyle changed, so that I could detox all those antibiotics and what it did to my body for all those years. And I understand now that they're not forcing patients to do that anymore. I didn't understand why they were doing it, but it was what it was. And now I'm just trying to educate as many people, and as what you're doing as well. So I'm praying that many people will be able to see and understand what we're trying to explain to them right now, that there are all other alternatives, homeopathically, naturopathically, and spiritually, that we can use to heal and direct our bodies to cure itself, because our body is equipped with it, and it can, with the right direction, and that comes from you.
Well, yeah, go ahead.
Okay, so with the next slide, I'm going to call this guy Hector. When I saw this slide, so the line on Hector's face conveys what concept?
This is the concept of the mental field, or the acupuncture meridians, or what we call channels of energy flow that course through the body, but are not anatomically observable. In other words, in a regular anatomy class in medical or dental school, you won't find a meridian, although they have now located what they think are meridians through recent research in anatomy courses. They find that the meridians flow along the fascial planes or the ligaments and tendons. So they're getting some reality to that, but most people, the Hector shows this coursing of electrical energy field through the dental apparatus, as you see in the teeth area where the meridians go through. This is a kind of a crude representation of what the idea is. The interconnectivity, again, through the mental, from acupuncture points, the energetic field from the toes to the teeth and the top of the head. Everything is interconnected and affects everything else, like with your heart condition.
Right. And you pointed out the fascial concepts of your body and it being interconnected. That is so critical. And when people understand how intensely the body works for us every second of the day.
Yes.
If we can just open up and have better circulation, and that's why you're pointing out the acupuncture. But doctor, are there other ways to open up circulation, especially in the facial area, besides just acupuncture?
Well, facial massage is good. That's more physical, and also acupuncture. Mm-hmm. But there is another way of doing that with God's divine light.
Yes.
Through the art of true light. Yes. Called Mahikari no Waza. That's a fancy word for the art of giving light. Yes. And I'm able to do that in my practice quite frequently. People accept it and they love it. And I get really quite stellar results from my point of view. Yeah. So.
Wow.
That's everything is circulating, everything. And if
Yes.
it gets stagnant, like old people become stagnant, sitting
Yes.
in old people's home, playing checkers or chess or something like
Yes.
that, rather than being active in a profession or doing something out in a garden or going
Right.
for a walk with your wife, like I
Right.
try to do.
Yes. And the other visual I like to tell people about is, like when you go to the ocean side and you see the tide pools and the water comes up and sits in the pond and the tide drops and then the water evaporates and then you just have the salt. And
Correct.
so that's what's happening to many people's bodies is it's the salt, the liquids, the saline is crystallizing and causing a lot of blockage. And so thus
Exactly.
we don't have the best circulation. Then we have all kinds of issues and pains and our body gets stuck.
Yes,
And
exactly.
so we want to unstuck it, right, doctor?
Very exactly. Loosen up, let it go,
Yes,
smile, Ron,
yes,
smile, Wendy.
yes.
More dentists should, there's an old thing called the dentists don't smile because they're looking down in the mouth. It's an old saying. But anyway, this interconnectivity from Hector, and then maybe the next slide will show this curious presentation. This is called the acupuncture meridians running through teeth. Now, like if you look at the four front, upper, and lower teeth, they connect to the governor vessel, which is acupuncture, which is the urinary tract, bladder, reproductive organs. And so I've had many experiences where men who have had prostate cancer or indicators high PSA, once they took out the dead tooth on that meridian, it all cleared up. And it made me a believer. At first, I didn't accept these things. These concepts were foreign to my training. And of course, when we get out of school, we think we know everything, right? And we're not open to learning. So we have to have a flexible mind and a flexible spirit. So the meridian chart is, I wanted to present that for, again, the interconnectivity to the meridians, the physical anatomy, and the spiritual anatomy, because the spiritual anatomy is what drives creativity, wonder, and joy, and happiness. And when you're connected with that aspect, life is going beautifully, right? I can see it in
Right.
your face.
Wow. That's exciting that you experienced it and then you started learning more about it and then you started practicing and putting it into practical use. I'm I'm wishing and praying that it would be so simple for others to receive all this information and how they can heal their body by just hearing what you have to say. Honestly, I saw this movie called The Beautiful Truth. Have you seen that one, Ron?
No, I haven't seen that.
Okay, so you and Melissa, you need to watch it.
I
It's
will.
it's called The Beautiful Truth, and it's about a 15-year-old kid from Alaska who did a home-based project. Otherwise, he was going to get kicked out of school, and so he focused on all the problems of our health, and he hooked up with Dr. Charlotte Gerson, who is I believe the daughter or the granddaughter of Dr. Max Gerson.
Right, the
And
Gerson Clinic.
right,
Right.
and it was from this young boy is how I learned about what you're doing, because he had he went to a dental office and they had this, oh, I don't know what it's called, but they could detect the metals in the air. And as the dental assistant was mixing the amalgam and shaking it up, and they turned on the black light or whatever you call it, and they could see the fumes in the
Yes.
room. And
Right.
then they said that that's exactly what happens to us with our mouth. And so when they put it in our mouth, and every time we eat and we're doing like this, it's agitating the fumes to come out. And as simple, I'm putting it in layman's terms, and you can explain it in your terms, or Ron.
It just
Because
simply volatilizes, it
yes,
evaporates, it wears out. And when your teeth come together, the mercury emits into the body. So people get scared of that. But
yes,
that's nothing, the body is an incredible capacity to
yes,
detox if you give it
yes,
a chance.
yes,
But if you keep pumping in stuff into the body like root canal therapy,
yes,
amalgam fillings,
yes,
fluoride, and dental implants, you're just violating the sanctity of the inner part of the body. The
right,
body is actually under the skin, pure. There's no bacteria, viruses, and fungi.
yes,
That's why
yes,
you have the immune system. It comes in immediately to remediate that problem. like a toxic dump site, like in Ohio, when the train derailed and you had all this vinyl chloride. The body is trying to do that all the time, get rid of the toxins. So,
Right.
yeah.
And it's so important to understand this process. And when people understand it, I mean, even a simple fever, right? They want to nip the fever and take the fever away. No, let the fever happen. The fever is good. It's indicating to us something is going on in there and the body is fighting for us. But
Yes.
people don't understand that. And so that's why this is so crucial that you're here and explaining to people how simple our body is, but yet how simple it is to take care of it if we have the right tools, which is knowledge.
Yeah, exactly. How profound it is in its intricacy and interactionness and its simplicity.
Yes.
Yeah. So that's the key point. And this is actually what you just said was the awakening of our medical sciences, because we are the last ones to really catch on to the truth here, I think, because we got so much book knowledge. We've got so many years of practice. We've become jaded. We become cynically critical of other professions, like the Flexner Report, as I mentioned in the byline, was in 1910. They decided what would be taught in medical schools, and that's called pharmaceuticals. Nothing about homeopathy. They got rid of that. They got rid of any radionics, which are certain devices like the Vol machine or the zapper or some of these other things that really work, but they work anecdotally. You can't do a research project in a university. You're not going to get the funding anyway, because the government's not going to do that. And neither will Pfizer. They won't fund alternative medicine. So, but slowly but surely, the awakening is taking place in biological dentistry and the Holistic Dental Association and the many different associations. There are three major ones that people can find out more about. And that's in the show notes, I think, or something like that.
Right.
And if you want me to, I can get clearer on that for you. But that's the Holistic Dental Association. I'm a member of all three of them because I support this movement. And it's medical doctors, psychiatrists, nurses, clinicians, and dental assistants and acupuncturists that gather at these meetings. We're going to one at the end of this month in Las Vegas, Nevada. Not to gamble. I don't gamble. I don't want to. I'm too manini with my money to do that.
We work too hard for it.
Yes, I think so.
Wow. So let's carry on. So in your recent book entitled Death by Root Canal, I love that. And you'll explain why, I know. And the title just says it all. But what ill impacts of dead teeth and dental implants should we be made aware of?
The book itself is a rather bold statement, provocative, death by root canal, but the book is actually about life. As I say in the dedication, this is not about death, it's about life. Yes. But the slow blood poisoning will take place when you take any foreign objects and put them under the skin. Mm-hmm. Even the hip implant replacements, the knee replacements have their liability. Talk about having to take antibiotics. And usually the lifespan of a knee implant, hip implant, according to certain technologies, is about 5 years. But a dental implant, what happens is you have an opening, a wound opening into the jawbone, into the underlying tissue, which is sterile. And you can in-migrate all sorts of toxins. And recently the World Health Organization had mentioned about the potential carcinogenicity of titanium, which is used mostly in dental implants. Mm-hmm. But doctors won't tell you about that because it's equivocal. You can argue both sides, but the indicators are just it's a foreign object. It shouldn't be in the body. If you get a sliver under your skin, you have to pull that sliver out, or you'll get blood poisoning, or you'll have severe problems with local infection. So the book depicts that and shows the 34 years of research I've done in removing dead and infected teeth, plus implants, and sending to the pathology lab at Queens and getting back various reports that tell you this is not two good things. I did not believe that when I first heard about it in 1984, but I did my own research. I started to send them off to the path lab to get confirmation that they were infected, and every one of them was.
Wow.
So the book shows that clearly, and then gives also us the last chapter is about the Carlson Bridge innovation that comes through biological dentistry of using new materials rather than cutting teeth or injuring the body.
Right.
So that's the book.
Wow. I can't wait to read it as well as share it with others so that they too, I mean, I'm looking into people's mouths all the time. I'm like, hey, you know what? I think you go and need to visit my friend Ron. I think he can take care. You know, you're always sick or you got headaches or something's going on and you tried everything. And I know for a fact that we have a mutual friend, Pamela Sue, and she of course, she had a lot of health issues. And once she visited you and you took care of her and cleaned her mouth up, she just felt like a new Wahine. And
That's so, yeah.
She is so ever grateful to you and your mission of healing people, helping their bodies heal themselves by
Correct.
removing all those metals and toxins that they placed within. And who would have known? I mean, we were trying everything to get her healthy, to stop the headaches and everything. But once she did visit with you, her life changed and she became even younger looking because she didn't have the stress and the inflammation within her system any longer. And that's an amazing testimony in itself. So that's why, and you had experienced that as well. I want a lot of people to have this life-changing experience and then just by visiting with you and seeing what you can do for them.
Good. That's wonderful. Thank you for that.
Yeah. So in your next slide, what we see is a toothless image being filled. Please explain this slide.
Oh yeah, that's the innovation that actually it came out of the primary spiritual development course I did in 1989. I figured out a way to replace missing teeth without cutting them. It's unheard of. A gentleman had said to me, Ron, can you build a bridge for me without cutting my teeth? I said, no, you can't do that. That's called the dental reflex. But then I started to think about it. I said, do you want to experiment? And this guy from Maui said, let's go for it.
Wow.
So we did the first Carlson Bridge, which is nothing more than a composite material used across the missing area to give the and it can be used, you know, you can chew with it. You have to be gentle and careful because when you have a missing tooth, you have a prosthesis that's liable to break down. So this device called the Carlson Bridge now, it was patented, the patents have run, but I do it all the time in Honolulu. And we have about 60 doctors on the mainland that do this. I don't know how often they do it, but we have some practitioners that really take to it. And because it requires some skill and art and being able to sculpt the device, but it's really a fun thing to do for a dentist and very exciting for patients because they don't have to spend hours and hours in the chair taking bite registrations and cutting the teeth and, you know, having root canals done because the cutting of the teeth took place. So this innovation came actually out of the spiritual course I did with Sukiyama Ikari in 1989. And I'm glad it did. Thank you, God.
Yes, thank you, Father. And, you know, I might have to come and see you because I did lose a tooth. But I thought my only option was implants, and I refused. I refused to go that route, so I needed D. Yeah. And so I have a puka, and we're gonna see if we can get a Carlson Bridge in there as well. Well, we'll talk about that later.
We'll go there later. Yeah.
Yes. So I know that you have a product called Super Gums. Is this
Super
just
Gums
for older people who have plates?
Yes, it is basically for older people, but some young people have when they can't do a Carlson Bridge, we do a pop-in. It's a form of a Carlson Bridge, but this Super Gums is a biological, non-GMO, very healthy product. It's actually a food thickener, a combination, and it sticks better than any of the store-bought Fixodent or Polygrip or things like that. If you read the flyer that I have, the regular issue of over-the-counter adhesives have malic acid, have zinc, high levels of propylene glycol, and other things. That's antifreeze, and that holds the denture in. It gives a better chewability and it gives more confidence. But the super gums is a new innovation. About 6 years ago, I've used it mainly in my practice, but there are a lot of doctors on the mainland, a lot of patients call for it, and I send it to them through the mail. So it's something that's done in my office. I produce it there and then mail it out because I'm a tradesman. You know, I live under international trade laws. So those are, you know, that's the innovation, the other innovation. And we have actually the book, which explains, it doesn't get into fluoride or mercury's toxicity or super gums. But once you start hanging out with me, eventually you'll get it.
Very good.
With that.
So we can send people to your clinic to pick it up, or as you said, you can mail it out once.
Yes, they can come. All they have to do is order it through the 735-0282 number. And it's $10 for a bottle, and it works really dandy. You don't need a lot of it, and it stabilizes the plate so the person can properly chew.
Wow.
One of the biggest things among our elder populations is they can't chew food.
Right.
And because they niho ole without teeth, huh? Hawaiian. I learned that. Niho ole. So yeah. So the super gums is an antidote for that.
Wow, that's good to know. I mean, so guys who's watching this, you have moms, you have dads who have dentures that always like slip and you can hear them clanking away. This would be a nice stocking stuffer, a nice gift to give to them, knowing that you're helping them with a better product. And better yet, you should go send them to see Ron, and maybe he can go ahead and fix something better so that they won't have that problem as they're aging out and living their longevity in life. So give them better quality of life is what I'm saying, even as they're growing older.
Yeah, the super gums also helps in elimination and digestion. The materials contained in the powder, it's a powder, and you powder it into the denture. That will help with elimination and digestion.
Wow.
This is well documented.
Multi-purpose.
Yes.
So Ron, let me just ask you one last quick question. Where can people seeking biological dental care reach you?
Well, if the last slide, that's in the Kahala Mall area.
Yes.
My office is in the Kahala office tower, Suite 400. And the number is up on the board there, 735-0282, 735-0282. And they can always leave a message and I'll get right back to them. I run the office pretty much by myself. I don't work 9 to 10 at nighttime. So I do 3 or 5 hours a day and enjoy my life at my young age.
Very good. You got the recipe for good health.
I think so.
And plus you run home to your wife, Melissa, and I know she's listening in on us right now. And I know that you have a very excellent relationship.
Yes.
But Ron,
thank you, God.
Thank you, Jesus. Right now we've run out of time, and I knew we would, but I'd like to say mahalo to Dr. Ron Carlson, as we know him, Ron, for sharing your passion on how we can take our health back by simply removing the metals with our mouths as a beginning. So please, everyone, go and visit with Ron and put your money where your mouth and your health is. You're worth it. I'm Wendy Loh, and we'll return with another edition of Taking Your Health Back with Wendy Loh. Aloha and mahalo, Ron Carlson.
Aloha very much, Wendy. God bless.
Aloha, God bless.
Everybody is...
Thank you so much for watching ThinkTech Hawaii. If you like what we do, please like us and click the subscribe button on YouTube and the follow button on Vimeo. You can also follow us on Facebook, Instagram, and LinkedIn, and donate to us at thinktechhawaii.com. Mahalo.